I've helped over 200 nurses land their preferred specialty. And let me tell you where most nurses fail hard in their interview. It's the behavioral questions interview phase. 100%. It's not because they don't know how to tell stories, and it's not because they don't have the experience. It's because you are not knowing exactly what the interviewer wants to hear, and you're not really demonstrating the skills and strengths in a way that positions you for success. And as a nurse career coach, like I said, who's helped over 200 new nurses get hired in their preferred specialty, I'm going to tell you exactly how to answer these behavioral style questions, the rationales, and the whole breakdown. So make sure you watch until the end, because this last question could potentially cost you a job offer. And I'll tell you a real life story that literally happened today with one of my paid clients, my coaching clients. And I'm so glad that we went through this, because literally, if she would have tripped up on this question, she definitely would not get the offer. And I'm gonna share it with you at the end. So watch till the end. So if you're ready, let's get into it. So the number one question that managers love to ask is, tell me a time you went above and beyond for a patient. Okay, here's where most nurses go wrong. Most nurses think that they're just going to say something that is part of the job. Let me give you an example. Today, I actually asked my client when we were practicing these behavioral style questions, and she actually gave me a story that was underwhelming. It was literally just part of the job. Giving someone food, giving somebody blankets, that is not above and beyond. That is literally just part of the job description. Okay, we need to do better. You need to go above and beyond. Helping somebody get to the bathroom or transporting somebody somewhere simply ain't it. You gotta go deeper, and it's gotta be better. Literally, they have to be like, oh wow, like it has to be that good. A quick little example of this, let's say you have a post-surgical patient who is cleared for a full diet, and maybe dietary is not responding, or they're super busy, and maybe the patient is requesting something specific off the menu, but they don't really have it, right? Like let's say they want watermelon or some specific fruit. If you were to clear it with, let's say, the charge nurse to step off the unit and to maybe go across the street and purchase that fruit, with the permission of the staff and the supervisor, then that small gesture is, yes, going above and beyond, because you're literally getting out of your way to get something for this patient outside of the hospital. And another strong example, this is actually from me. I used to be an ER nurse. This was years and years ago. I was working at a hospital system, and most hospital systems, they don't allow female and males to be in the same room once they're admitted. But what happened was there was this sweet older couple. They both fell, something happened. They both fell trying to help each other. So they both needed to be admitted, and they did not want to be separated. So when they got admitted, they were actually going to be given 2 separate rooms on 2 different floors. But I escalated this, talked to the charge nurse, talked to supervisors, talked to bed board, and I actually had to get clearance to get them in a semi-private room so that they could actually be in the same room together. They were so grateful, so happy, so thankful. And because really it would improve their process of getting better and healing. So what you want to do is just break down the situation, tell them, the background story and what you did that wasn't really expected, beyond the job, and then what impact it made on the patient and how that made you feel as well. Number 2, tell me a time when a patient was not happy with the care. So this could be a patient or a family member. And really what they're looking for in this answer is how you handle customer service, how you handle conflict, and are you able to do something called service recovery. So this all has to do with patient experience and essentially customer service. So the reality, I'll give you an example in the ED. There are many people who are frustrated, many people in pain, waiting, and literally they'll take it out on you. Like I said, I used to be ER nurse for 13 years, worked in level 1 trauma centers where some of the waiting rooms were packed, jam-packed. I was a triage nurse a lot of times, and literally we would get things thrown at us at the triage window, like crazy things, crazy. I got a story for days, okay? But we don't got time for that. Interviewer just essentially wants to know, can you handle situations without it escalating? And are you able to de-escalate, bring the patient back to a place where they can be happy again? Because that's really essentially customer service, customer care. A couple things you can do is acknowledge they're frustrated. Don't go there trying to defend yourself, whether it's your patient, not your patient. If you run into something like this, you want to take accountability and just say, hey, my name is this, introduce yourself, what your role is, and ask them, hey, I see you're visibly, upset. What happened? Can I help you with something? And acknowledge how they're feeling. Make sure that it's in a private setting, professional, your tone is nice and low, concerning, and you're asking from a place of curiosity. You can try to distract people if possible with, water, TV, if they're waiting, things like that. And then just be honest and transparent. Don't make promises that you can't keep. And then help them understand what's going on. Not to make them feel lesser than, because that might make them more upset. But explain and break things down in a way they can understand so that they don't feel dismissed. They don't feel like they're not being valued or seen. But really the way to address it, I'm sorry, for this experience. This is not what we want for our patients or our families. What can I do right now to make it better? And then genuinely find a solution that can fix the problem. Maybe if they're waiting on a lab result, call the lab and find out. Maybe if they're waiting for an x-ray or a CAT scan, expedite that somehow. See what you can do to make it happen right then and there. And don't just take off and say, I'll figure it out and come back, because then they'll be more upset. So figure out the situation, come up with a plan, communicate that plan, come up with the resolution, and share the time frame that it might take approximately, and then ensure them that you will come back and give them the result exactly, or have the resolution immediately for them, and that you're not going to delay this. Okay, so that reassurance will really help them. Okay, so a strong example of this is being, like I said, being an ER nurse. A lot of people would come in with lacerations, like small lacerations, maybe on their hand or their foot or something like that. And obviously in the ER, it's an acuity system, and it depends, on the severity of the injury, what you're there for. Everything gets categorized, right? So something like that, you don't want to dismiss it, but you want to explain, how long the wait might be, do anything that might alleviate their pain, ice pack, elevate their leg, and then just, make them understand, it's not life-threatening. And if they're concerned that hey, if I have to wait this many hours, is this going to be okay for my cut? Educate in a way that will resolve their anxiety, and then reassure them that, that you haven't forgotten about them. You're doing everything you can to get them in as soon as possible. For a lot of you, you've been probably trying to figure this out for a long time. You don't know what stories to tell. You're like, do I use the story? Do I not tell it? How do I tell the story? What parts of it do I emphasize or bring down? So you might need some guidance with this, right? And some of you may have been looking for a job for, let's say, 3 months, 6 months, and now you got this opportunity for this interview and you don't want to mess it up. So I invite you to actually attend my webinar. It's free, and we dive deeper into those topics of how to stand out in your interviews, how to sound super confident, and I give you more tips and strategies on this webinar. So you definitely don't want to miss it. And here's what I know. The nurses that get hired are sometimes not the ones that look the best on paper or the most experienced. It's the nurses who are prepared, and it's the nurses who are confident and who know how to interview very well. Okay, so this is why I host this weekly webinar. And again, You don't want to miss the webinar. These are the exact frameworks and strategies that I actually share in my webinar with my private coaching clients that actually pay me as a nurse career coach to teach them. You want to attend to get all the gems, get all the tea, and of course, you'll get the opportunity to learn a little bit about my coaching program at the end of the webinar. But I'm telling you, it is jam-packed with value. You don't want to miss it. And sometimes nurses that attend the webinar, they get hired just from attending the webinar. It's free. It only takes a minute to sign up. So the description to sign up is below, newnursejob.com. So go and check it out. Once it's filled, that's it. You got to wait until the next one. Okay? And if you've been stuck for months, getting rejections and not making it to the next stage of the interview phase, not getting the offer, this webinar is literally built for you. So don't mess around. You get to come hang out with me for about an hour. We'll have some fun and we'll dive deeper into these topics. And you'll have the opportunity to ask me questions live. I'll be live and in the flesh, okay? Number 3, tell me about a time you noticed a change in condition in a patient and what did you do about it? So they want to assess your assessment skills here, right? So what they're really asking is, do you know your patients? Can you recognize changes? Can you recognize symptoms and signs that can prevent patients from deteriorating? And do you know when and how to escalate situations? And can you stay calm under pressure? And can you stay calm during emergencies? And are you able to take the correct action to help this patient out? But more importantly, do you recognize that there is a change? Okay, that is the big question. So if you don't necessarily have one of those stories that you can actually tell, I would dive deep and kind of like reflect and see what clinical rotations you've had. Have you had a job as a CNA or a PCT? Or maybe if you didn't actually act on it, maybe you saw a situation where you can kind of describe it. So here is a simple one that you may have faced and you probably don't remember. So this might trigger your memory. So recently, one of my actual paid clients in my coaching program did share this. She was a student with her preceptor. Her preceptor asked her to go into the room and do vital signs on a patient, which she had seen earlier in the day. So she was going in for routine vitals and she noticed that the patient didn't look the same. The patient seemed different, seemed off, didn't look right. So before she even finished the vitals, she's like, something is off with this patient. So she actually called her preceptor immediately without leaving the patient, but called the preceptor to come in. So when the vital signs were completed, I don't remember the exact vitals, but they were not the best looking vitals. I think the person was maybe hypotensive or something like that. So the preceptor came in and they together did the assessment and realized something was wrong, and they called a rapid response. And then the rapid response team came. That patient needed to be moved up to a higher level of care into the ICU. So just from her being a student nurse, walking in and recognizing that is massive. She could have just simply took the vitals and then just went and left and didn't say anything, but she had the judgment to see before the vitals even finished, like, hey, this patient did not look like this before. And something has changed. I don't know exactly what it is, but something is not right. That is what they're looking for in your interview. Try to keep it concise. Just get to the point, okay? We don't need to like dive deep into all these extraneous, non-relevant details. Number 4, tell me a time when a patient didn't agree with their plan of care. This happens pretty often in the hospital setting, especially with elderly patients, especially, maybe if they don't understand what's going on, or maybe if there's like a touch of dementia or whatever the case is. So this is how to answer this question. This is the framework for y'all, okay? Number 1, acknowledge their concern and validate what they're feeling, and then ask them why they're feeling that way. And then figure out and assess the actual why. Why are they refusing? Why are they refusing the care or the medication or the procedure? Is there a fear or anxiety based? Do they not understand what it is? Do they not understand that they need it? Is it an education deficit? Or is it they're afraid, simply afraid? Or is it that nobody explained it properly to them? Or is there a religious belief or something else? So know why they are not agreeing with the plan of care and figure out that underlying reason. That is key. Then you're going to make sure that they have all the information to make an informed decision. Part of that is telling them, hey, here's all the info. Here are the choices. If you make this choice, this is what happens. If you make that choice, that's what happens. You got to tell them the consequence of both or whatever so they can make a well-informed decision. Okay, so educate clearly without any judgment or persuasion of anything. And if you need to bring in a third party, like a social worker, a chaplain, pastoral care, maybe a family member that can talk to them, whatever the case is, you can also bring a third person or a third party in, okay? And then if they make their decision, they know what's going on, they're alert and orientated, and they can make that decision, then respect their wishes. And that's it. Just notify the team, notify the attending, and then if they have to come down and like explain some stuff, then they might, whatever the case is. But make sure that it's all documented, and then you document the education and all the things. And that's what you would say in your interview. Number 5, tell me a time you were part of an emergency and what role did you play in that team, okay? If you played a small role, that's okay. I had a past client once where she said she was a student in a code situation. Her preceptor got busy in the code, so she didn't know what to do. She actually saw a family member, somewhere to the side, and I don't think social work was there at the time or anything like that. So she just quickly asked her preceptor if she could go stand next to the family member and just comfort them, and that's what she did. The family was by themselves, so she went over, talked to them, stayed with them, comforted them. And that was really meaningful, especially if you're a family member in a code, you don't know what's going on, everybody's busy at that time. It could be super overwhelming. So she said later, the family member really thanked her for being next to her. I want to give you a side story. Okay, this is the scoop that I want to tell you about. Literally happened today. My client, I was preparing her for an interview, and we were going through one particular question. And she mentioned that at her past job, I'm not going to say where, that a patient had chest pain. And in that facility, it's not attached to a hospital or anything like that. So there's no emergency services. So patient had chest pain. They described it as chest tightness. And they don't have any ability to run labs or EKG or anything like that. She brought it up to her supervisor, talked to the attending, and the attending said, yes, patient needs to go to the ER. But listen to this. She said that the way they did things at that facility is somebody apparently delegated that this patient go into, I think it was a CNA or PCT's private car or something like that, to get transported to the ER that was only a couple minutes away. And I was like, no way. I was like, stop right there. I don't even want to hear anymore. And again, this was years ago. I was like, what? That should not be happening. So I was like, girl, we need to reframe this story, because that is not the right thing to do. So if you're ever stuck in a situation like that, or you work somewhere like that, you cannot do things out of the scope of practice, okay? It has to be safe. You can't just do random things like that. So the proper thing to do is to call EMS and have EMS come take the patient and bring them to the emergency department, okay? So basically we just had to reframe it to say what happened was they coordinated the care to have the patient go to the ER and escalate the plan of care to have the patient go to the ER. All I'm saying is you don't have to give extraneous details that is not correct or not the right thing to do, okay? And then also in some of these behavioral style questions, you never want to highlight any negative things. Moving on to number 6. Have you ever had conflict with a coworker? I don't really like this question, but sometimes they love to ask it. So unless you have like a really good, really good example, I would try to avoid this. And some people just haven't had any conflict. So I would just be honest if you haven't had any major conflict and say that you typically get along well with everybody. But if you did have a conflict with a coworker, this is how you would handle it. So obviously you would stay professional, remove any emotion out. I know it's hard to do because you like assume things, and then like you have to have a lot of emotional intelligence, and really have self-regulation of your emotions, and then focus on concrete facts and concrete examples. Okay, address it privately, never publicly, okay, because you don't want it to escalate. All right, we don't want no drama. Okay, no drama. All right, and then basically come to a resolution, and then address the situation, present the different solutions, pick the solution, address it, and then move on. And that's it. And then number 7, to wrap it up, tell me about a time you advocated for a patient. Okay, this is where most people go wrong because they don't know how to answer it. And really, advocacy is the core of nursing, and listening to patients is the core of advocacy as well. Okay, and really making sure that patients have a good, safe outcome, improved outcomes, that patients feel heard and listened to, right? Listening is the foundation of advocacy. Okay, if we don't listen to our patients, we're not going to know what's going on and how to advocate for them. Do not ignore patients. One big thing that I've seen is I've worked in so many different hospital systems, and sometimes they don't use the appropriate interpreter services. Sometimes they'll try to pull in staff that are not certified interpreters, and that is the wrong thing to do. So if you see that, you need to call it out and say, hey, this is not a certified interpreter. Here's the interpreter phone, and advocate for that patient that they properly use that form of communication so that the patient has an interpreter phone. And just because someone speaks English doesn't mean that their capacity to fully understand is there. So they might still need an interpreter. Some places have in-person interpreters and some have the phone or different systems, okay? So, maybe if you've stepped in and did that, that's one thing. Another one where I've seen is like sometimes we'll try to discharge patients in the ER too early. It's happened to me. And this is where your gut instinct comes in and your assessment skills come in. I was in a level 1 trauma center. Quick story. Patient was like assaulted. She had a bunch of imaging done, but not all the images, some images done, but they kept saying that she was a drug seeker. She was looking for medications, And I was like, no, something is not right. They were trying to discharge her. I did her vitals. You shouldn't discharge anybody unless you have recent vitals, literally within minutes. So I did her vital signs and she was tachycardic and hypotensive. I was like, no, something is not right. She had a lot of abdominal pain. So I told the attending, I was like, I am not discharging this patient. She is not safe to be discharged. You need to re-examine her. They didn't like me. I didn't care. I was like, this is what advocacy is. So advocated for her and stood my ground. I was like, you need to come reassess her. They reassessed her, brought her to CAT scan, and guess what? This woman had a ruptured spleen. She had to go to the OR and ended up being admitted. So this is what I'm talking about. What we do is serious business. We literally have people's lives in our hand. So this is why when I say, like, I'm not just prepping you for interviews, I'm prepping you for your career to be a strong advocate. And this is what interviewers are looking for. So, I know that was a kind of a big advocacy story, but dig deep and see what type of stories that you can actually say that you're an advocate for, okay? Another one is, they might ask you stuff about DEI, health equity, what that means to you, and how you've advocated for those things, okay? So diversity, equity, and inclusion, obviously, is important in today's healthcare. And then don't shy away from real topics that are happening in healthcare. This is what they want to see in your interview, that you're able to bring up these controversial topics or, hard to speak about things, because if you can, they know that you will not have an issue advocating, okay? So don't try to go in there with your textbook terminology, trying to sound fancy. Be as real as possible in these interviews, and that is what will get you hired. Being prepared is what will get you hired. This is it, y'all. Okay, so now you have the model answers for the behavioral style questions that can make or break your nursing interview. Here's what I want you to remember. Knowing the answers in your head is not the same as delivering it with confidence, and delivering it with confidence while you're speaking to these interviewers, okay? So if you freeze, you ramble, you go blank under pressure, you may lose the offer, and you don't want that, okay? So in the next video, I'm gonna cover mindset and what you need to nail your interview and how to show up with that confidence. So make sure I see you at the next free webinar. Sign up below. And if you're not subscribed, what are you waiting for? Subscribe to the channel, and I'll see you in the next video.